Thank you, Brandon and Jack. All right, now that you guys understand more about the mechanism behind how our treatment plan works and how nanotechnology can be applied to treatment for chemotherapy, it's important to understand the goals of our trial. And so, the number one goal of our trial is to treat brain tumors more effectively. And by this, we mean we want to treat tumors in a way that limits other side effects. Of course, with any chemotherapy drug, or pharmaceutical, there's going to be side effects such as decreased liver function or higher blood pressure as just ulterior effects to medication. And so, one of our goals is to treat brain tumors in a way that is effective towards the brain tumor itself while also limiting ulterior effects that can be harmful to other organ systems. Our second goal is to combat metastasis within the brain. And this means that we want to limit the spread of cancer within the patient. We want to localize the cancer so that it stays within the brain and so that rapid growth does not spread towards other organs, ultimately leading to potential death if it were to enter the bloodstream, for example, and go to maybe the lungs or to other important vital organs of the body. Our third goal is to decrease treatment time by using a system that takes the actual chemotherapy lomustine drug and specializes it so that it enters just the cancer cells and not the healthy cells. We're able to maximize the rapidity, the rapidness at which we can decrease these cancerous growths. More focused treatment will make it faster because if we're not treating all cells and treating just the specific ones that need the treatment, we find that we can limit cell growth while also reducing potential damage and slowing the functioning of other organ systems. Our fourth goal is to increase the efficacy of the treatment. And by this, we mean that we want to increase the treatment's effectiveness. With any treatment in medicine, of course, there's going to be a percentage that is not non-functioning. With chemotherapy, you don't see a 100% success rate. And so, with our specialized method of nanoparticle mode of transmission, we want our treatment to be extremely effective in reducing cancerous cells in the majority of patients. We want everyone to be able to reap the benefits of our potential treatment. Our fifth and final goal is to elevate the patient experience. As I mentioned earlier, with any drug or any mode of medical treatment, there's going to be side effects. And in many cases, these adverse effects are not very appealing towards patients. And so, by using a nanoparticle in order to deliver our drugs to cancerous cells, we intend to reduce the time it takes that for patients to experience these potential side effects, and we also want them to have a speedy recovery. And so that is a huge part that plays into elevating the patient experience. Next, we're going to talk about more of the hypothesis that went to the creation of our clinical trial. And so the main hypothesis that we propose is that the group whose treatment includes chitosan as the vector for delivering lomustine to the brain tumor will have a higher efficacy rate and will be able to stop the tumor growth in a faster manner, compared to the group taking lomustine on its own to treat the brain tumor, who will be slower. In turn, efficacy will be measured using cancer cell size measurements. Next, let's describe more of the actual trial itself. We plan to use a single blind procedure in which the scientists or the doctors will be unaware of who receives the drugs. The scientists / doctors will be aware of who receives the drugs, while the patients will be unaware of who receives the drugs. We can do this because the chemotherapy drug using the chitosan vector will be a normal chemotherapy drug, whereas the nanoparticle drug will also be in a pill form and will be orally administered. And so both should be fairly indistinguishable from each other. And so by using a single blind procedure, we can limit the bias among the patients so that say one group were to know that they were receiving a certain treatment as compared to the normal chemotherapy treatment, they may act differently just purely based off of psychologically. They believe that, oh, if I'm being treated, maybe the efficacy for me will be higher, and so you'll fake personal responses, and the data will be completely skewed or confounded. And so, by using a single blind procedure, we make both groups blind to which treatment they receive, which will make it so that we can attribute all changes and all efficacy rates to the specialized drug treatment itself. To create these groups, we're going to take those 100 or so volunteers initially, and we're going to use random assignment in order to generate two randomly assorted groups. We're going to do this using a random number generator, where every patient will be given a number, and then using a generator without replacement, we'll take half and then put one into the control group that will receive the chemotherapy drug, while the other half will receive the nanotechnology enhanced pill. Some of the constants or the controlled variables that we would like to keep normalized, standardized in order to make our experiment optimal is we're going to administer the pill at the same time. We're going to use the same dosage for each pill. And post-consumption, we want to quarantine or have the patients perform the same activities so that one does not vary that much from the other. So post-consumption behavior will also be controlled to make it so that potential confounding variables are not also applied. The independent variable is going to be the treatment or pill that each group receives, which is normal chemotherapy versus the nanoparticle enhanced pill. And then the dependent variable that we will be measuring is the size of the tumor. And the way we're going to measure this is through taking MRI scans or imaging of the patients before and after treatment, and measuring the diameter of the tumor cells inside of their brains. During every juncture of the step of the experiment, we will have our patients given information, and then so that we can get informed consent. They'll know that they will be receiving chemotherapy of some sort, and post-study results will also be divulged to all patients so that they know exactly how they contributed to the experiment and what their data means. All right, so now let's talk about who exactly is eligible for the study. Of course, no one with a family history of lung cancer is eligible to participate in this study because they would be especially susceptible to the effects of the drug. And so we don't want them to potentially be at risk because, of course, that would be extremely unethical. They must be over the age of 18. We found that when we were studying our vector we're using in order to carry the nanoparticle lomustine drug, that in most cases, you're already supposed to be over the age of 18. And so maybe with time and more clinical trials, we can potentially reduce this age limit. But at first, we will be starting at an age minimum of 18 years old. Of course, you're going to have general chemo treatment qualifications. And so this includes having good weight, good height, good diet, good biometrics. You can't come into the study already being, on your last line. You can't be extremely unhealthy. We need people who can potentially face potential risks, because with any clinical trial, there's always going to be risks. And so we want to take the healthiest people possible. Of course, they're going to have brain cancer, but we want the healthiest brain cancer patients that are strong and are going to be able to withstand mentally and physically the effects of chemotherapy. Initially, the trial is going to use 100 volunteers, which we're going to be able to take and assess through oncologists. We'll specialize first at using brain cancer patients. So we'll have oncologists if there's a certain brain cancer patient who has already tried different methods, such as normal chemotherapy or surgical removal, that have potentially no other options left. And so these oncologists will ask them at the end of their treatments, hey, there's a clinical trial going, would you potentially be interested? And so that's where we're going to use 100 volunteers. And at first, we're going to start with 100 volunteers, but over time, if the efficacy of our treatment starts to increase, we would like to also increase and do more clinical trials to maybe 1,000 volunteers or 2,000 volunteers. And then finally, for the safety procedures of our clinical trial, the most important facet of our study is to have informed consent of the potential risks and benefits for each patient. We want them to know the potential risks of receiving chemotherapy treatment, and that includes the side effects. But we will also like to tell them about the benefits, the pros versus the cons, so that they can weigh them themselves and make an informed consent based off of actual information. We don't want to deceive any of our patients. The trial will be thoroughly reviewed by the Institutional Review Board and also by professionals in medicine and drug administration. This is extremely important for us because we want as many eyes on this trial as possible, because we don't want it to be something that is kept in the secret and is something that is extremely unethical. We want review boards, scientists, oncologists, pharmacists, everyone that is anyone to be able to review the potential effects and the risks of our treatment and to weigh them against the potential gains. And then after this, if all these conditions are met, there will be consistent monitoring of patients during the clinical trials of their biometrics. And so this includes heart rate, blood pressure, breathing rate, all the fine, minute details that are so important to health. And we want them to all be maintained at a safe level. If at any point during the clinical trial we notice that a patient is at potential risks, or there's trends of maybe say increased blood pressure or potential increased trends of risk for heart attack or anything of that nature, we're going to want to stop it. And also, to make it so that it can be more easily stopped, we're going to use dosages in a series. Instead of giving the patients the full treatment in one go, we're going to slowly wean them and slowly introduce them to more and more higher dosages, so that if, say, after the first initial dose, one patient reacts in an adverse way, we can go ahead and stop it there instead of treating them fully the very first time and maybe potentially killing that patient. And then finally, prior to the administration, participants will be assessed for their medical history or genetic-based personal efficacy for lomustine and current health conditions. It's important that we screen all volunteers extremely thoroughly to learn that they potentially may have risk factors that can be triggered by this type of chemotherapy treatment. And so we're going to check up on their medical history, make sure that everything is in check so that they can take this drug and it will be effective at treating them. Thank you very much. If you have any questions, I bet Jack and Braden are going to be amazing at answering them.